Hello and good evening. Welcome to the Crisp TV, and we are ending the session. We are ending the day two of the almost the last sessions now. And I'm your host, Dr. Abad Khan. I'm an interventional cardiologist currently practicing in St. Joseph Hospital, Ghaziabad. And with me today, we have for our Crisp talk, we have Dr. S. Selvamani. He's practicing in Meenakshi Mission Hospital, Madurai, in Tamil Nadu. Sir, good evening and welcome.
Yeah, good evening. Good evening.
Sir, how is the perception and optimism about the artificial intelligence in cardiology with relation to the electrocardiogram, the echocardiography, nuclear cardiology, remote monitoring, and other wearable devices like?
Yeah, AI, artificial intelligence, has really picked up for cardiology. When you start AI in cardiology, probably I think you should start right from clinical history, probably from the clinical review, and from there our basic thing, ECG, and as you rightly said, echocardiography also. And coming to angiogram also, it can interpret. And for imaging, especially, we have optical coherence tomography, where AI intelligence has been used, and we are really benefiting from that. And to be very precise, when coming to history taking or for the patient history, AI definitely helps. For example, all these years, what we have been doing is you take history and doctor, we decide upon the differential diagnosis, and then you go about further imaging. To aid this, all the information has been fed to AI, and AI definitely helps you in making a decision. Not only that, it makes it faster. And as a human error, sometimes you might not think of something which AI might give an intuition that you should think on that line also. So it is very helpful. And ECG AI has been there for such a long time now, and I think it's more than 20 years. We have computer analyzed ECG analysis, and now with assistance of AI, that has improved. What has happened is, especially when you get a ECG at the remote center, probably a primary care physician really may not be very familiar with ECG, but AI definitely helps them in coming to a diagnosis, or at least thinking about a diagnosis. And for us also as a specialist, there are certain issues which takes time. For example, heart rate or heart rate variability. All those things, AI will definitely help you and give an immediate result, which we can use in our real-time practice. That is one. And again, coming to optical coherence tomography, that is imaging during angioplasty. It is a very excellent advancement. What we do is, once you get a OCT image, the AI itself tells you what is the size of the vessel. So that is, we look into EL to EL diameter, which we were practically looking manually in most of our cases all these days. But now we have an AI which assists us to make out the AI, EL to EL diameter. And many times in raw data, you may not be able to see the EL in all the positions. But AI points out EL is seen at this location so that you can make use of it for your measurement. Apart from that, calcium is one of the very important determinant of angioplasty. AI detects calcium and it tells you where the calcium is located. And number two, it tells you the thickness of calcium, and we can also make out the arc of calcium. What is the arc and what is the circumference of the vessel it is covered. And at the same time, it tells you the length of the calcium, which helps us in taking a decision regarding our management strategy.
Perfectly put, sir. Absolutely. Talking to the lens of an interventional cardiologist, like he is doing in all his cases, and just increasing and coming furthering the topic that the ability of AI to diagnose diseases like other spectrum, like valvular heart disease, acute MIs on ECGs, like we have told, the RA variability or the arrhythmias, it's already making huge progress. It's already available on various Apple Watches. Um, uh, Mayo Clinic has set up an all database for its OPDs also and electrophysiology. It's taking as a pilot project first in the starting AI in OPDs, as you were taking that history taking, and all the data has been feeded to that. Ultron 2, which we are already saying that we have shown the glimpse of what AI can do in Ultron, or the OCT can decrease the contrast load also. So, what do you think, and how the cardiology is shaping up with the help of AI for the betterment of the future?
Yeah, one point you should always remember, AI is not a replacement for a cardiologist or a doctor or for it in any specialty. AI works with the cardiologist. It is your companion, which helps you to make sure that you are not missing out on something due to probably a human error or something. So the advantage of AI is there is no fatigability. For example, when I start a case in the morning, I'm different, and probably at the end of the day, when you have finished with 10 cases, there is a natural human exhaustion which is not there with AI. So you can give them any amount of cases or any volume. It works at the same precision. So that's a very big advantage of AI, and we should always remember it works with us, and it's our companion, and it is never a replacement for a doctor or a cardiologist.
So the punch point and the punch line has come up from sir that lose the human errors, but don't lose the human touch. And addressing the challenge when implementing AI, sir, we have already talked about that there is risk of bias also. The ECG has already, we have already pre-fitted the database with the 5 lakh ECGs already printed. So the risk of bias remains that the pattern has gone up like this, and whether in 25-year-old or 35-year-old or a 90-year-old, it will tell us the same thing. Same, it has limited generalizability. The quality of data may not be as good as the humans, although there is always a source of error also. And the other limitation that difficult to be published when we are taking information or help from the AI. How do you include all these parameters while going forward, sir?
Yeah, definitely all these parameters, as I already told, it has to be scrutinized by the doctor. So it helps you or it assists you in your scrutinization and your work. And you cannot just leave alone AI for all the decisions, because after all you are treating humans, and there should be especially a human touch in that. A specific doctor or a specialist should supervise, and probably for his work it is going to help us. That is what I can say as of now.
Perfectly, sir. Perfectly, sir. Apart from this academic, We recently saw some amazing advancement in technology being displayed. Recently, Elon Musk displayed his AI robots. Do you believe that not so in remotely future or distant future, where fully autonomous robots, maybe 50 years down the line, or maybe even 20 years down the line, maybe fully autonomous AI or robots will be doing angioplasty competently and independently, and where they are almost guided by people who are sitting in their rooms or in their OPDs.
Yeah, it is already initiated. You know that we have robotic angioplasty, which is something called as remote operation for angioplasty. As of now, it is at the early stages, the budding stages. Probably the technology has to improve further, so it can be applied in wide scale usage. And definitely there is a bright future for that. And we'll have to just wait for the time and see. And it is going to happen that the work will be done by robotics, and it will be supervised by humans. So I think that is how it is going to be.
So as the sir says, future looks promising, but we are just here to stay, and we are also here to say, sir, a few rapid fire questions just before we end the session. You may choose to answer howsoever you may like, sir. What is your gut feeling like? Do you want to be treated by a human touch or by an AI?
Yeah, I think the combination of both will be excellent. Either AI or only human, compared to AI plus human, is going to be best.
Yeah, plus
I think
human.
the combination will be there. Always
Perfect.
human touch should be there.
Always human touch should be there. Perfectly, sir. This is absolutely important. Sir, are you an early adopter of a new technology or a late adopter?
Probably I try to adopt newer technologies at the earliest point possible. And if there is a good clinical evidence, I feel if my intuition says probably it is going to be good and no harm, definitely I adopt.
So early adopter, sir, is an early adopter. And do you find, as of today, do you find in 2024, do you find more thrill in the cath lab, more thrill teaching content, academic content, or more thrill traveling?
I think a combination of all three is thrilling, but you'll have to balance your work. Probably if you are not in the cath lab, you cannot teach. Or if you don't teach, whatever you have learned is not useful. And without traveling, you cannot meet people, networking and teaching may not be possible. All three are important. So you balance all these three activities, your work, your teaching, as well as your travel, so that you are balanced and do a good work.
Perfectly, sir. And sir, angioplasty PCI or medical therapy in a stable angina patient?
Yeah, in a stable angina, it is always said that probably there are certain subcategories, like probably proximal LAD, left main disease, LV dysfunction. So these are the common indications for revascularization. I think we should still follow that.
Still follow that. Perfectly following the guidelines as should the wisdom be. And to end it all, sir, tea or coffee, sir?
Anything is fine.
Anything is fine for sir. Perfectly. That's how we end the day on day 2 of the CRISP TV. Thank you, Dr. Sivalami, sir. We'll be meeting soon, sir. Thank you.
Thank you. Thank you, sir.